on mute. Here you go. So please mute yourself unless you are speaking. We also kindly ask you to respect the privacy of one another. We want to make sure we try our best for making our webinars welcoming, safe, and comfortable for everyone involved. We hope you have a good time. Let me now briefly present the agenda for today and the purpose of the meeting. Today we have a 90-minute session on the DataCare project. This is a partnership between Eurochild and UNICEF ICARO. Representatives from both organizations will soon introduce the project, why we are having this project, and its objectives. After those opening remarks from Eurochild and UNICEF ICARO, we will learn more from colleagues in the research project team about the research framework, the research plan, the expectations, how we're using the project outcomes, what actually involves very practically, the timeline, and how we'll plan to manipulate the data that we gather. The high number of participants, and thanks so much for expressing your interest, doesn't allow for any interaction during this meeting. It will be primarily information only. But please feel free to post your questions in the chat box in Zoom. We will try to answer your questions in the moment, or this will certainly be part of a follow-up to this event. While this project was initiated before the COVID crisis, the COVID pandemic, this current situation actually does heighten the need to know what's happening to children going into alternative care. It provides really space for an increased political visibility, for shining the light on the most vulnerable children and families. It puts a light on the need for better systems, for better monitoring of systems, to support progress across the EU. So this project is really more exciting than ever due to this momentum. Today and in the follow-up for this webinar, we are seeking for allies at national level who can help with access to information, so we can identify similar data across countries in Europe for more comparable data in this area. Before we get started, we want to have a very quick anonymous pool, which is now on the screen. Hope you can all see it. It's asking 2 questions with multiple choices to know more who is in the room, in the virtual room, and what's the motivation, why you are joining, basically. And soon after, we will kick off the proceedings. Thank you to those who already filled in the 2 questions. I see that almost everybody took the time to reply. Okay, I'll now ending the poll and will share the results. Yeah? So it's mostly researcher, yeah, not surprisingly. And yeah, you want to know more about the project. Hopefully you will be interested also in becoming a national correspondent. So it's up to us to convince and attract your attention. Let's hope that we do a good job today. Thank you. I now stop sharing the results. And I'm very happy now to introduce Jana Hainsworth, Eurochild Secretary General, and Aaron Greenberger, Senior Regional Advisor for Europe and Central Asia, Child Protection at UNICEF. Jana and Aaron, the floor is yours for initial introductions. Thank you very much.
Jana, you're muted.
Jana, you're muted, yes.
Can you hear me? Yes, okay, thank you. I'm sorry, I'm still getting used to this technology, even after so many months. So a very warm welcome from my side. I'm Jana Hainsworth, Secretary General of Eurochild. Many of you I know who are on this call, warm welcome to you, but also all of those of you who are new to Eurochild. I hope that you will find this session interesting and useful. Very encouraged that 45% of our participants who responded to the survey are interested in becoming national correspondents. That is the main purpose of today's session, is to share with you the work that has been done on the research protocol, the national template, and to hopefully entice you to become part of this work to gather information on data collection systems across Europe on children in alternative care. So as Agatha has said, this work started long before the COVID crisis, and it might feel that in amongst all of the most pressing needs of children and families, this could feel a little bit of a bureaucratic exercise. But from our point of view, this issue of accurate, comparable, reliable data is absolutely crucial to enable us to move forward with structural reform, systemic change, and ensuring children have the right care and support when and how needed. So as Gaspard Fat will talk about in his presentation as our Senior Research Coordinator, we know and believe that data is the bloodstream of policy making. So it's very difficult to make accurate policy decisions without getting reliable data. And this project is primarily aimed at helping the European Union to bring comparable data across Europe to support their policy making, which is a real window of opportunity at the moment. Eurochild has been working on children in alternative care since 2008, where we've been convening members in exchange and learning. And over 10 years ago, we started our own exercise to pull together national surveys on the situation of children in alternative care, which we published in 2010. Maria Herzog with us today, our then president, which was a real groundbreaking piece of work, but was done really with the goodwill of our membership across Europe. And what we realized that it was almost impossible to get any comparability across the data because of the way that national data collection systems defined different types of care, the reasons of children going into care and the aftercare. And so since then, this issue has grown in importance at political level, at the European Union level. We've had many years of very significant investment of EU funding to support the transition from institutional to community-based care, which has in some cases worked very well, but in other cases has been perhaps deployed in the wrong way as accelerated reforms in a way that hasn't been the best interest of children and young people. And where we are now, and I'm sure Aaron will speak to this as well, is that we have an extraordinary window of opportunity. As this issue has grown in political attention, there is now the ambition of the European Commission to launch a European Child Guarantee initiative, which is currently being drafted and will be published in the spring of next year. And it's looking at the types of services, supports and policies that can help inclusion of the most vulnerable children, in particular, children with disabilities, children in the alternative care system, migrant and refugee children, and children in precarious family situations. And what we're interested in is how will the European Union be able to track progress once this initiative comes into force? It's expected to be both a political declaration, but also unleashing significant funding through the European Social Fund. Now, much work has already been done. I think Veronique Lerch is on the call with us this afternoon. She was involved in the feasibility study of the European Child Guarantee, trying to track data on the numbers of children in institutional care across the European Union. And it was extremely difficult to collect that information in any reliable way. So that is the basis of why we have felt it so important to continue this work. And that's why we've set this ambitious project together with senior researchers and well-known experts in the child protection field guiding this work in order for us to attract national correspondents who will then fill in the national templates, understanding how the system defines different types of alternative care, where is the data stored, how is it used, and that through that, we can come together to identify key recommendations for the European Union to hopefully develop a system of comparative data analysis across the European Union. As you'll hear today, there's an immediate urgent wave of analysis that we want to get our hands on, because in early January, we are planning to have a high-level webinar with policymakers so that we can start to give recommendations on what the indicator framework could or should look like when the European Child Guarantee is published and launched in the spring of 2021. So we have a very ambitious agenda, and we hope that the details that you receive today from our research partners on how we've constructed the research protocol and the research template will entice you to get involved. I'm going to leave the floor now to Aaron, and hopefully will complement what I've just introduced here today.
Thank you so much, Jana, and thank you for making the first Zoom blunder. It's always nice not to be the first one to make a Zoom blunder, although I'm sure I'll manage to make the second at some point. Colleagues, thanks so much for having me to say a few words. Jana summarized it, but I'll just build into a few of the streams that are super important for UNICEF, and I think for Eurochild and all of you as well. And it is the moment that we're in, largely attributable to the work that you've been doing for many years. And Jana spoke about the report in 2010, of course. You know, in the current multi-annual financial framework of the EU, which is expiring in just a few months, there is a strong provision in European structural and investment funds that are used by member states, which they can't be used for institutional care. They must be used for the transition from institutional to family and community-based. This was an enormous achievement in and of itself. For the last 7 years, there has been tremendous progress and a lot of challenges in making sure that other funds that the EU is dispersing don't violate the principle that is captured in ESFI, in the European Structural and Investment Fund pool, which is out of ESF, and many others, including on the implementation side. But it is a victory. It is a huge victory, a victory that we celebrate every day, and now we build on. One of the major, so what we see now as we look to the next MFF, the next multi-annual financial framework, which begins in 2021 and will last through 2027, is again a strong commitment to deinstitutionalization because of the advocacy that continues to be done around this by groups like yourselves, UNICEF, and many others. Member states, there's not much of a question anymore about the principle, which is fantastic. The how, the pace, the definitions are still a bit up in the air, but there isn't this sense of, is this an area that is worth attention? And that is a significant achievement. But yet we still lack at EU-wide level, despite these policy commitments. So we're going to see again a commitment to DI, both in the child guarantee, but also as a standalone. It could be represented twice, actually, in external action. So it's really planted itself in many pieces of the EU's architecture, both internally and externally. But the EU still can't say how many children are in institutional care and foster care in every country. It can't say that. I mean, there's so much more that we can't say that is so much more important, that is so important to say. Why children come into care, how they leave care, how they do aftercare. But we can't even say across the EU, despite these political commitments, how many children are in institutional or residential care across Europe by country. And if the Commission, empowered by the Council and the Parliament to pursue an ambitious shared reform agenda on transitioning from institutional to family and community-based care, can't monitor the implementation of that through a very simple proxy of the number of children in institutional care in every country to start with, if that's the principle, then we have to answer that question first. I think we're close, and that's what we get, right? You get many countries with some data. Every country, I think, sitting around this table has some data somewhere, but how that data is defined, how it's collected, has never been analyzed to see what are the commonalities, where are the gaps, and in particular, what stream of support will the Commission, or should the Commission open up to strengthen data collection systems across member states to advance the goal of having a comparable base of indicators. And I think a big part of this, as the UNICEF is excited about, in addition to all of the richness that will come out at the country level, that will inform country level actions to come, is how we can position this at the European level, as Jana had said, to make a strong case for an investment in data systems strengthening and research, and to show, hopefully, that we don't have that far to go, that so much exists already, that we're not talking about the need for a 10 or 20-year investment. We're talking about the need of a 5-year investment that will get the Commission to a place where in the next MFF, or even maybe in the middle of this MFF, we can start having a very clear landscape of real children affected by a policy priority that is shared across EU member states. UNICEF is also particularly excited about this because whatever the EU does for its internal action inevitably resonates in its neighborhood and beyond. So for us, this is already resonating in the Western Balkans and in Eastern Europe, and I think will continue to resonate out further as the EU continues to lead in this important area. I'll end there and say thank you again, and I look forward to this engagement, and it's so nice to be here with all of you.
Thanks so much, Jana and Aaron, for setting the scene and the rationale for this project. Gaspar Fait, Senior Research Coordinator for the DataCare project, will now introduce the research protocol and the national template, which are the main project tools. Gaspar works closely with Maria Herzog, Chief Scientific Advisor for the DataCare project and Chair of the Research Advisory Group. And I'm very happy to see that several members of the Research Advisory Group have managed to find time to be with us in this call today. Thank you very much. Gaspar, the floor is yours.
Thank you very much. We are going to do this time a PowerPoint, so I expect Kieran to launch the PowerPoint. So, good afternoon, and let me say that I'm very happy that I can present you the work that we have done so far, and we very much hope that you will stay with us throughout this project up to next year, where hopefully we will be able to present the findings. So this is the DataCare project, and I'm going to talk about what is the DataCare project. Next slide, please. What is the DataCare project about? What is the rationale? What is the vision? And so on about the project. So this is an ambitious project. It's a Eurochild UNICEF project, collaboration to map and analyze data in a large number of countries. We want to cover all EU countries, and we hope also to cover the United Kingdom. We have 3 main research questions. Do national systems that collect data on children in alternative care do they collect the data needed for family-centered policy on alternative care? Second question, what alternative care definitions are used locally? And can common ground be found to establish comparable definitions reflecting international concepts? The third, what promising practices exist in different countries? We have the project tools presented today, the research protocol and national template, and also the glossary is quite important. We have a small research team, I'm part of. We have the research advisory group that has already been referred to, and we have, hopefully, are going to have national correspondents supported also by further key information. Next slide, please. So this is the DataCare Research Protocol, the table of content. We can just move smoothly to the next slide. So why are we doing this? Jana and Aaron has already said a lot about this, about our motivation. But it is clear that this grew out of concern that the deinstitutionalization and the reform of the child protection system in European countries are not going at a speed that would be desirable. It grew also out of frustration that a lot of data that researchers or policymakers or the concerned public would need is just not available. But it grew out of also of the hope that a lot of data is available at the national level, and the national statistical practices in some countries or several countries show very good practice that other countries could just emulate. And also that we can find, we can establish and get to the common European indicators on children in care. So we want to document and share good statistical practice in the countries, because we have a concern about the child protection reforms, about the EU cohesion, deinstitutionalization program, and also that because we need better evidence. Next slide, please. Now, these gaps that were listed in the previous slide could actually be turned into a long-term vision. So what are the changes that we would like to see in Europe to happen? So we listed here 9 points, and many of these points have been raised throughout the discussion, also with members of the advisory board or members of Eurochild as we were preparing for this project. The European countries should use international definition, possibly common statistical methodology that ensure comparability of data on children in alternative care. The data are disaggregated by type of care, sex, disability status, and country of origin to see the impact of reforms. The reasons for anti-destination use common definitions, which is also not the case today. And several more points that you can read on the screen. Next slide, please. So this is basically the same slide, just showing that in this research, we are focusing mainly on the first 3 points. But our understanding is that if we make progress at this very basic level, I think we are contributing to a reform of the alternative care system statistics that could hopefully feed into changes in policies. We want to a change at all levels on the longer term. Next slide, please. The leading concept that we are using throughout this research is the UN definition of the alternative care of children. This is actually quite a recent definition. In 2010, the UN General Assembly endorsed a set of principles, guidelines, and this gave a definition of alternative care. Kieran, can you click one more? So it's just to bring the emphasis that if you look carefully at this definition, there are some things there that are quite important. That children in alternative care should be those who, even with appropriate support, the family cannot care for the child. And also, if for those children, we need to ensure appropriate alternative care. Now, it's important to say that while the guidelines offer very clear conceptual framework, it offers no guidance for measurement. So there's a gap here that we have a relatively new and clear conceptual frame, but we don't have clear guidance how we should measure. It is clear that measuring what is appropriate support would be important. But at the moment, I think we have to work, as Aaron and others said, with the statistics that we have already there. So on the longer term, this concept may need some special statistical surveys, introducing some new measurement ways. At the moment, what we want to achieve here is to have progress showing what could be approximated, what could be approximating this new UN concept, and what guidance could be provided to measure the appropriateness of care. So the project objectives include exploring the frontiers of international comparability and policy relevance of the evidence. But at the same time, we also want to start filling the gaps, the data gaps, with broadly comparable data on children in alternative care, in formal and informal care, residential care, and family-based care in Europe. And we want to focus on highlighting opportunities for further improvement in alternative care and reporting systems, the care data and reporting systems. Next slide, please. This figure shows basically the landscape as it is emerging in the UN guidelines. So the alternative care could be broken down into children in formal care and children in informal care. Formal care then consists of residential care and family-based care, which is under the formal care. Now, these concepts are very clearly defined in the UN guidelines. And these three levels is where basically our research focuses on in the first place. Because we are, as statisticians, we know that it is easier to achieve comparability at the higher level of aggregates. As Jana has been referring to, the 1990 experience has also shown that it's not easy in the area of alternative care to find comparable numbers. But the higher we go, possibly we hope the easier. So we want to start at the level of formal alternative care, residential care, formal family-based care. And in as much as possible, we also would like to see that how countries are defining and measuring institutional care, special homes, small group homes, foster care, other family-based care, or how well or how much they break down, for example, foster care, according to what we mainly find in the international literature. So you can look at these 5 levels of aggregation. Our focus is mainly on the first 3, but we very much appreciate if the national research, the national correspondents can also provide us information on the level 4 and level 5. Next slide, please. So basically, we have this framework provided by the UN guidelines and international practice. And we have, in every country, some set of national provisions. So the key question is that how these, granular level national provisions could be allocated to the international concepts. If we read carefully the concept of alternative care, then it becomes clear that juvenile justice is not going to be part of our research here, because it's not included in the alternative care concept. Children who are in boarding schools, not for child protection reasons, but mainly for studying, similarly should not be included, and so on. So the conceptual issues are quite important, and we need to pay due attention to it. Next slide, please. Also, the research scope is important. We're focusing on children as defined in the UN Convention on the Rights of the Child. And many statistics that we find in different countries include also older children, because of course there are problems of giving care. So it may be quite a challenge in some countries to clarify that out of the number of children in different care provisions, who are those who are actually children and who are those who are older adolescents, young people. Also, it's important that we are focusing on official statistics. Our focus, our objective is to improve on the longer term official statistics. So this is what we are looking at, and this is what we are scrutinizing. And we are looking at the methodological issues. So we focus chiefly on what data are being collected and how they are made available, rather than on collecting the available data. This said, we are also asking the National Correspondents to provide us some data, but that is mainly for methodological purpose. At the moment, in this phase of the research, we want to understand the data systems, and having data points, actual data points could help in the process. The research method, tools, and partners. So we can say that we have these two phases. The first phase, when we are focusing on understanding data system and dissemination practices. And we have the second phase, when we involve also the national statistical agencies, those who are actually doing the surveys, those who are producing the data, making or not making the data available. Now, in many countries, this could be, we want to handle this quite in a flexible way. In many countries, it is easy to establish compact statistical offices that are very well available. The statistical offices is actually could turn out to be a key partner. We can just smoothly move on. We start by understanding the system. We start asking contacting statistical offices, making questions, and they can become natural partner in this process. In other countries, it might necessitate first to understand the system, and then have a sort of an official request to the statistical offices to become partner in this exercise. So we are doing primary research here, that we are focusing on the survey questionnaires and the data instructions. This is a very important part of research. It hasn't been done so far, at least we haven't met. That instead of just looking at the published data, we want to understand that what data is being collected and what are the data instructions. So how data is being produced, what is available, what is that is not available, not because it is not published, but it was not even collected. And then we hope also that we'll do a proper data literature review based on published data, and we can look at this together, and then we can see how much of the data that in theory could be made available are actually made available. And then we can start a dialogue, understanding, clarifying conceptual issues, show the key indicators at the national level and how this relates to the international concepts. Next slide, please. These are the main project outputs: a research brief, the national reports, which may or may not be published separately, a discussion summary report where we're going to analyze the data systems in the 28 countries, and have a policy brief with some key recommendations that could be presented at high level policy forum. Next slide, please. So now we move to the national, the DataCare Project national template. And this is basically how we organize. We have some notes there, which I think quite important. We want to map the data system. We look at the national definitions. We look at also the quality of care, information and quality of care. And we allow space for a commentary on how the data system works. Next slide, please. So this shows, this slide shows that how we are actually collecting the data. What you see here is data collection, one of the core data collection tools, which we call Table A. We are asking national correspondents to list the relevant statistical questionnaires and instructions. So we want to understand that what data is available, what type of surveys are available. So we're asking what is the purpose, what is the agency that enters data, the type of provisions, and the questionnaire that the question asks about. And importantly, we would also like to see ourselves the questionnaires. So we see that as an important source of actual information, if we can see that how the national survey questionnaires look like and how the national instructions for filling in those questionnaires look like. Once we understand that what surveys are there and who are managing those, the data management agency information about data management agencies are collected in a table called Table B that I'm showing here. We are also seeing some questions about the legislation. So what are the directives behind the data collection, and what is the dissemination practice of the data? Next slide, please. Now here, as I mentioned, we are not just doing a research of explaining things or trying to understand things. We also try to operationalize the concept, get from the national concepts to international concepts. We try to break paths to the international concepts. So in doing so, first we are collecting the national care provision concepts at the most granular level. This is a list that you are including here in Table C, asking the national correspondent to provide a list of alternative care provisions that exist in the country. Then we list what surveys this covering. What is the national definition of the concept? And importantly, we're also asking that, okay, so for a recent year where you have relatively comprehensive data, what data does exists on this provision? Sometimes this data will be referring to the end of the year, and sometimes it will be entry into care or exit from care. These are so-called flow data. So depending on what data is available for that provision, they are offering here some space to include the most recent data that is comprehensively available. Now, once we understand that what are provisions that exist and data is provided for, then they're asking in the next table that I'm not showing here, but is in the template, that what are the national data aggregates, what are used for producing the indicators that are in use in the country. So, for example, C1, C2, C3 could all come together for a national aggregate on children in residential care, for example, or children in foster care. So, what are your national concepts and how these elementary granular level concepts, how they're aggregated provided into a more aggregated concept. Next slide, please. Sorry, if you can go back for a second. Thank you. So just, here, I'm just reiterating that figure that I was showing that there are these national provisions, and this is the table that we're actually collecting. And we also, in table D, want to see that how these are organized nationally. Next slide. Here, this looks like a quite complicated table, but actually I don't think it is so complicated. It is almost like a, programming set of instructions. But what they are trying to do here is they try to recast the national concepts and demonstrate how this could be fitting into the international concept framework that I was showing you earlier. So this takes, if you follow the instructions, I'm only showing here the first three level of instructions that in the table on the right side. But on the left side, you also see that what are the type of international concepts that are going to be illustrated, made available if you follow through these instructions. The question is that look at the national provision C1 as it was presented in the earlier table. We are asking that do children in this care provision fall under the international definition of children with alternative care? You have to make a decision, yes or no. If no, then drop from your list because it is out of concern and take the next national level provision. If yes, then continue further. So do this, then this provision fall under the international definition of formal alternative care. If yes, continue. Do the children in this care fall under the international definition of residential care? And so on. Why we are saying here to leave space empty is because basically if you add up children in residential care and children in family-based care and children in informal care, if you have done that, then basically you are getting the children in alternative care concept. So basically, from this, you can create the international aggregates at that three level that I was showing you earlier. The next slide, please. We have still time. So this just illustrates that if this small triangle just show the national provision types, C1, C2, and so on. And you are allocating basically to different places. So some of these provisions fall under the international concept of residential care as part of alternative care, or formal family-based care, or informal care, if there is information around that. Next one, please. So if we can have information, as the previous slide was showing, we are already quite happy. We can already demonstrate that even with existing data system, it is possible at multi-country level, hopefully European level, show that how many children are in residential care are comparable. But we hope also that this slide show that based on the information that we get from the template, we'll be able to show some more details. Now, a special issue is informal care, because most of the surveys, most of the data that are available on children in alternative care is going to come from routine administrative data collection. So that normally does not cover informal care in the families. But there are some other data sources, like the national census, population census, or household surveys, that in theory at least should cover also those children who are cared informally, and there should be in theory in a large number of countries information available. But I admit that it's quite difficult to find, but if you can find such data, it would strengthen the are confident that the data they are producing are comparable. Because if in some countries, quite a large number of children enter into informal care, then possibly less children will be entering in the formal care. So in a way, although it's more like a footnote in our exercise, but it would put some light that what are the proportions of children in formal care within the broader concept of alternative care, and what is the proportion of children in informal care. Next slide, please. Now, as I mentioned, we also want to throw some light on the capacity of data system to report on care quality. So we are producing a 17-point checklist that examines the presence of core and policy relevant data points in the survey questionnaires on alternative care. Now, the prior exercise requires not just access to the statistical questionnaires, but it requires also a good understanding of the national care provision and the concept that are used in the national systems and in the international system. This exercise of understanding the capacity of data system to report on care quality, I would see it as somewhat easier, because basically, if we manage to put our hands on the statistical questionnaires, then we can see that what are the type of data the different countries are collecting. We can highlight that in some countries, very interesting, highly policy relevant information is being raised. In other countries, they are basically just having data like a number of places or number of care providers, number of staff, and so on, which is important, but still, doesn't offer us very in-depth, insightful picture. So here we put together 17 points that we would like to National Correspondents to have a look. But also our focus is not just on the 17 points. We are very much hoping that as National Correspondents go through this list, they will also realize that, in my country, there are quite a lot of valuable policy information is being asked, is being collected, that may not be available in other countries. So if you can put that in your analysis, that will also be clear. Now we have some special questions also about residential care. There we want to have information on the facilities, number of children, how long they stay in care, important information that is often missing, the staff numbers. And we would like to make a distinction there. In general residential care and small group homes, because our policy advisors see it really important that we highlight how many children are actually in institutional care within or family-like care, like the small group home care. That's why we are also asking about the size about which residential care facilities are considered large institutions. Ideally, all children should be in family care. But what we are adamant that no large institution should exist in Europe in the 21st century. So it's not easy to define what is an institution. UN guidelines gives highlights, and it is discussed in the literature that what are those characteristics. Institutional care prioritizes more on the care environment rather than on children. So therefore, it's quite important to explore that what share of children are in institutional care, and what are those that are not in small groups of family-like provisions. We see the reform in many countries move to that direction, but we don't have clarity that where do we stand in that move. Next slide, please. So this slide shows the checklist. These are basically, once we have in hand the survey questionnaire, it could be that, but for all provisions in the country, there is just everybody just guess and have to fill out the same questionnaire. It also could be that different groups of provisions have different questionnaires. So this is to be found out. But these are the issues that any of these questionnaires, we can have a look. Are they collecting data on children, for example, by age, by gender, and there, girls and boys, or also further concepts of gender, the country of origin, ethnicity, religion, disability status, parental status, the reason for entry. We expect here national categories, showing quite a difference. Which actually, if you think through, there's not much reason why those reasons should be so different in the statistics in different countries. We hope very much as one outcome of this project could be that, for example, most countries will just move to a unified concept of, of the reasons for entry. So this is, quite an important policy information hidden there. And if you have an international comparison, if we can do an international comparison on the reasons, even though with all the limitations, data recording and understanding, so on, that would be still quite important. The entry into care came into force by administrative decision or by judicial decision. Again, could be quite different in different countries and makes a difference in the due process possible. The children who are the record of assessment on entry, children who are the documentation before referral, children who have a care plan, children whose placement was reviewed recently. Now, what is recent again could be quite different nationally, but we are just asking our national correspondent to show that how recent is defined in their own countries. Children who had in-person family contact over the last 6 months or over any period that is defined there. So basically, these are the important characteristics that ideally the system should show. I would say also it's quite, this is not very high expectation for a good statistical system on children alternative care. So, we hope that we will find countries, as I said, that there will be more. What is the age at leaving, vaccination leaving? Now, in the national template, we are providing some more details. But, again, this is up to our national correspondents, what you find in your national statistical questionnaire. Next slide, please. So this should help us understanding, different systems. And finally, the template has also space on commentary on the data system alternative care. What conclusions emerge? What challenges the system faces? What key technological directions do routine and survey census-like data collection show? It may be that several countries, there is a move towards different type of systems, and we'd like to get an update on that. What recommendations could be made so that alternative care can inform policy better? What recent changes have happened in reporting? What problems did you encounter while putting together the report? And who helped you in this exercise? It is clear that filling in the national template is quite a laborious job, but we hope also there's something that is also super interesting, and we ourselves will try to fill in some of the questions for our own countries, and very much looking forward comparing our findings with findings from other countries. Next slide, please. Next slide.
much, Gaspar, for this detailed walking through the framework and the main tools. That was very helpful to give an overview of where our thinking is. And now I'm delighted to introduce Florence Koendering. She's technical advisor for the DataCare project. Florence will give an overview of the timeline, the expectations, what support we can offer to national correspondents, and what are the next steps. Florence will be sharing her own slides. Florence, the floor is yours.
Thank you very much, Agata. And thank you to Gaspar for explaining to us the protocol and the, oh, 1 second, sorry. And the national template, and I hope it's made everyone very enthusiastic and eager to become involved in this project. So the national template, apart from the technical part that Gaspar explained, also contains a number of notes on what we expect from national correspondents, and that is what we're going to have a look at now. So we'll look at what we expect from national correspondents, certain details on how we would like information to be delivered, the support that's available for national correspondents, the timeline, and then hopefully there will be time to answer some of the questions that you have put in the chat box throughout Gaspar's presentation. So as both Jana and Gaspar and also Aaron have pointed out, this is a very ambitious project, and we are aware of that, to collect data like this for 28 countries in the DataCare project. So we want to be clear that we would like any national correspondent to provide as much information as you're able to give, but we are aware that it might not always be possible to provide all the information asked for. First of all, some countries will quite simply not have certain information or certain data. And it might also be that you in your position don't have access to the information or the data that we're looking for. So we're just asking you to provide what you can. And it would be useful if you can indicate whether it's confirmed that the information is not available in your country or not, because which is useful in the research project. So that makes, there's a difference between I can't access it or I haven't been able to find out whether it's there, or I know that it's not there. So this confirmation is very valuable information for us. As Gaspar pointed out, but we want to emphasize it one more time, the focus of the information we're looking for is on the data system rather than the alternative care system. We are looking for how data is collected, analyzed, managed, and published on all children in alternative care, rather than trying to map the alternative care system itself. As I said, 28 countries, that's going to bring in national reports with lots and lots of data, which all needs to be analyzed and processed. So
we lost Florence.
Yeah, it looks like I dropped out just there. Can you hear me again?
Yes, now yes. Okay, we are all assured. You're back.
Okay, I'm very sad. I don't know what happened there. I suddenly disappeared. Let's go back to, yes. So we're back here. So we're asking you to keep your answers concise, to make it manageable, to get through all of the information needed. And there is a glossary. There were some questions in the chat box about that. Together with the national template and the protocol, we send a glossary document which holds the international definitions that we use as kind of standard in this project. And it's useful to keep that side by side with the work you're doing. So to make a comparison, we know that the national definitions are often not the same as the international definitions or the definitions that we use for this project. And essentially this research is about that, about the difference between the national definitions and the usually internationally used ones. So for right now. Then the information that we are looking for, as I said, you might not always be able to provide everything that we are asking for, and we ask that you prioritize sending links to or copies of questionnaires and surveys and their instructions, because these documents are the foundation stone of the research. If we have those documents, there is a lot of information we can already find on what data is collected, what kind of data points are used, what questions are asked and what questions are not asked. So that is definitely a priority. And if there are English translations of these documents, we ask that you also send copies and links to them as well as those in the original language. Then for all the definitions and names of care provisions, names of agencies, names of data points, we ask you to provide the terms in your national language, official documents with English translations, which are not entirely correct. So it is important to double check English translations that you come across and maybe discuss these with colleagues to see that they are as accurate as possible to avoid confusion. There are also countries where there are no definitions that are nationally relevant. These could be countries that are decentralized, countries that have a federal system where different states, provinces, cantonments, Länder have their own systems with their own definitions and their own categories. In these cases, we ask that you provide us with as many definitions for different jurisdictions as you're able to, and to indicate what jurisdictions they are applicable in. As Gasper mentioned, we do not look to have a mapping of the alternative care system. We are not looking for full data on the alternative care system, but getting some data is a control tool on how the system. Please, in certain places, we do ask for data and we request that you provide it. And we ask that you give data that is as recent as possible and not from before, might not entirely fit what is happening in your country. We request that you still provide information and data if you feel it is more or less in the direction of the question that is asked, and then to give an explanation of why you feel that it is fitting to give that information with that question and how it's different from what the question asks. Then the communication, which is part of the next step. The first step is we hope you are all signing a letter of intent to become a voluntary national correspondent. You do the work. Part of the communication is on your end. For example, if you are unable to answer certain questions because you don't have access to certain databases or information, or because it is not your field of expertise, we ask that you look for other experts in your country, and either for you to approach them to collaborate and see if you can gather all the information, or for you to give us information about experts that you feel are better placed to answer certain questions so that we can approach them. Then the DataCare team will encourage and facilitate contacts between national correspondents across countries to help you build a network of mutual support. This network can be relevant in the DataCare project, but also outside it by meeting other experts in your own field. And after
we lost Florence again. Florence,
yeah, I think I'm back again. Hear me?
Yeah.
I don't know why this is suddenly happening. I haven't had any Zoom problems for a long time.
Florence, maybe you can turn your video off.
Okay. Yeah, that might be safer. Okay, so once you will still probably be contacted by the DataCare team in the course of the analysis phase. This can be for clarification of information you've given, or to help with validation of the data, or maybe offices in your country, so that we are able to dive deeper into the data that is possible, that is available, and to see what is being done with that. There will be support available throughout the DataCare project. When there are questions, or if you are in any need of support, you can contact Kieran O'Donnell at the Eurochild Secretariat at this email address. And Gaspar and Maria Herzog will be available for question and answer sessions, which right now are planned for about an hour every other week. And we will see how the demand is, whether it's needed more or less often, and national correspondents will be informed of that. And all national correspondents are welcome to join these sessions and ask any correspondence. And the gathering of national reports will be done in 2 waves. This webinar is the start of the first wave, the recruitment of national correspondents of the first wave, after which data will be gathered. Now, usually national correspondents will be given 6 weeks to submit their report. However, in early January, there's a plan for a high-level webinar where big stakeholders like UNICEF, OECD, FRA, and EU representatives will be invited to discuss the initial discussion brief coming out of the first wave of this research project. To have your national report included in this discussion brief and in this webinar, you will need to submit your data before the 1st of December so that we have the month
yeah. So keep taking out.
Yeah,
the
I'm back again.
Yeah, Florence.
Okay, we're almost at the end of the presentation. I'll turn the screen share off. I hope that will help. So to be able to have your data included, the data from your country included in the initial discussion brief for the webinar, you will have to submit your national report before the 1st of December, because we will need the month of December to analyze and process that data and put the initial discussion brief together. Then after that webinar, there will be recruitment of national correspondents for the second wave and data gathered and analyzed for the second wave. So here you have an overview of the timeline, which is essentially what I've just discussed, and the timeline will end with hopefully a launch of the discussion report in June 2021. Now I can answer just addressed in the presentation. The glossary is a very important part of the whole research project because of the definitions. And yes, it has been mentioned a few times, you know, it's important to have, for example, definitions of small group homes. But one of the points of the DataCare project is to find out how different countries define some things like what makes a small group home and what makes a big institution. So these are things that are not mandated. We are not asking you to say, okay, this is a group home because you say this many children is a group home. We want to know in your country, this is called a group home. And it doesn't matter if in your country they say if it's more than 4 children, it's not a small group home, or you can have 50 children in a small group home. We just want to know. And this is also why we are asking for the definitions. Why we want you to say not just, for example, in Holland, the local term of a small group home would be a woongroep, which you can translate into small group home, but we don't just want that term in Dutch and that term in English. We also want the definition of how many children would be a small group home. And then that helps with the comparability, because it's great to say, okay, all these countries have small group homes, but in some countries, a small group home can have only 4 children. In another country, they have 50. That is not comparable data. It's the same term, but it's not comparable data. So these are kind of definitions that we do not provide, but which we are asking you to provide us. And then at the end, when we have the overview of the 28 countries, we can make recommendations based on the differences and similarities in different countries. There have also been a number of questions on the scope of the research project. We agree at the start of this project, we were also even more ambitious than we are now. There were lots and lots of things that we wanted to include. including not just alternative care, but children under welfare, children being helped in their families. There are lots and lots of things which we would have liked to include, and all of them are very important. But the thing is that what we are doing now is already extremely ambitious, and we need to make sure that we can actually deliver what we set out to do. So that is why we have very tight limits set on the scope, which include that we will not be including children over, young people over 18. We will not be including children in contact with the law in detention. We will not be including children in boarding schools or in families. And, you know, all those things would be great to have. But right now we're starting with this. And then hopefully, if we do a really good job on this, people will be so energized that we will be enabled to do other phases and to add those things on later on to get a more complete picture. And that also includes for the data points that we're looking for. We definitely do look at the exit routes. Exit routes is included in the 17 points in the national template. However, we don't right now look at things like well-being, because it's much harder to define those things into data points that are likely to show up in surveys. So again, while we are aware that it is extremely important, it's just not within what we are currently able to do. I think those were the main questions that came up before I started sharing my screen. I can have a quick look to see if there's anything else.
Thank you very much, Florence. I'd like to ask Jana if she wants to complement anyhow, and to conclude with some closing remarks.
Thank you, Agatha. Am I unmuted? Yes, no. I'm still muted.
We can hear you, Jana.
I can, okay. So another Zoom blunder. I just want to thank everybody for all of the questions that have been put into the chat. I think Florence responded quite clearly in terms of the parameters of this piece of work. And I can only kind of reinforce that the emphasis of the output and the outcome of this project is what is comparable across country. And inevitably, in that exercise of trying to get to cross-Europe comparable indicators, we will lose a huge amount of the granularity and all the very, very important issues that are important to us as child rights advocates. But we aim to influence a monitoring framework that will provide a tool for the European Union, the European Commission, and the member states to track progress. Of course, a proxy around the types of care where children are placed is far from the true picture, but it's an entry door into the conversation that then us as children's rights advocates, experts in the field, would have an entry door into conversations with policymakers about the changes and the progress that needs to be made in the alternative care system and in the data collection systems. So it's an entry point to allow for a conversation. But in order for us to get even to that entry point, we need to know how all the countries are defining and collecting data. So as Florence clearly said, the aim of the project is really to look at the difference between how national systems are defining different types of care, entry and exit, and then how do we transcribe that into what we have provided in the glossary as the as our sort of standard, international standards, but it's not to say that we should be imposing that. It's precisely the opposite. We're trying to say we start from what is in the country and how system is defined, and then we look how could these be transferable or into an international system. There are a number of other questions, and we will take the time to respond to them in writing. We're expecting one national correspondent. If there is more interest in a country, that's something we would like to accommodate, because clearly different people have different areas of expertise, and it would be impossible for this to be done by one person alone. There was also a question earlier about having a template. We agree, having an example of this done in one country will be very useful. We have colleagues in Portugal that have had a very good attempt at putting this together. We're also working on one for Hungary and possibly Ireland. Those are close to being final, and I'm hoping that they would be available for anybody interested to understand what we're expecting as the final output from the national templates. The protocol that's available now, when we do the first analysis, as Florence said, we are aiming for the first analysis of the first cohort of countries in December. There are likely to be adjustments that we'll need to make, but we think that this framework we spent quite a lot of time toing and froing to try to get a framework that is as easy and applicable as possible to use in different country contexts. Yeah, our real ambition is that at that policy roundtable or webinar that we organize in January, we can already start to influence the drafting of an eventual European Child Guarantee. And as Aaron already said in the introduction, this is very important for operational programs. So these are the programs used by countries to invest the European structural and investment funds. We want to show to the policymakers that getting to some cross-country comparable framework is an achievable goal, and an achievable goal within the next few years. So this the work that we bring together from the different countries will be really, really crucial to enable us to do that. Well, I don't think is there anything else, colleagues, that I've missed from this this closing? Really hoping that we haven't scared you off, but that we are enticing you to be part of this important work. As you've heard, we have an excellent research team. Gaspar and Maria Herzog, who's been answering some questions in the chat. She's now back in the US, but will be very much part of the questions and answers and the guiding of the National Correspondents' work. And Florence is supporting there on the technical advice and also the editing, and trying to make this possible to understand simply by the audience that we need to reach in the policy sphere. So we're really looking forward to working with you. I think there are some practical questions that we'll seek to respond to over the course of the next month or so. Just to know, if you are interested in the first wave, then obviously the timeline is quite short in order for us to have a convincing document ready for the webinar in January. And I think there is questions in the chat which I'm reading now about what's in it for the National Correspondents. Is there funding available? There is a very tight budget line for the work. We haven't allocated money to finance the data collection exercise. If that is a barrier to your participation, then we will look into that and see if there's any way we can tap into more resources. What's in it? So the exercise is we believe, groundbreaking in terms of shaping how the EU funds and tracks progress in reforms across the European Union. And what's very important to say is that this work was really driven in accession countries and in the new member states. But right now, as we look to the framing of the child guarantee and the availability of recovery and resilience funds, we're putting children and children's rights and child welfare at the very heart of that whole recovery and resilience planning, of which part of that is children at risk and in the child protection system. So there are real opportunities for this to be a watershed moment in how we can support countries to improve their systems. So yeah, is that enough incentive? If you're having doubts about how and why, but it's still a temptation because of your research interest, then let's work with that on a bilateral basis. We're really keen to get as many experts from across Europe as possible to engage with us on this work. So we're coming up to the end. It's now 3:30. We'll take all these comments, and if you have comments that you would wish to send us by email, please do so. We'll be putting together a Q&A response, and yeah, we really hope that as many of you as possible will be able to join us. All of the presentations from today will be made available as well. Thank you very much, everybody, for taking the time to be with us this afternoon, and we hope to be working with many of you as we go forward. Thank you. Agatha.
Thank you very much indeed. Thanks everybody for attending. We will be issuing a recording when we come back to you following this call with an invitation to express interest, and you will be welcome to ask questions or request any clarifications you still might need. Thank you very much, and let's keep in touch. Bye bye.